Section 4, Prenatal Development. In this section, we will characterize the course of prenatal development and its hazards. Prenatal development is the period of time between conception and birth. Conception is the moment when a single sperm fertilizes an ovum. The prenatal period is approximately 266 days long and divided into 3 periods: germinal, embryonic, and fetal. These 3 periods are not the same length as each other. We're not talking about trimesters. The germinal and embryonic stage are relatively short, and then the vast majority of prenatal development is comprised of the fetal period. The germinal period is the first 2 weeks after conception. The ovary has released an egg, which has been fertilized by a sperm as it travels down the fallopian tube. As it continues its journey to the uterus, the cells begin dividing over and over again until it is a thick bundle of mast cells called a blastocyst. When it gets to the uterus, it implants itself into the uterine lining. The process from conception to implantation takes about 2 weeks. By the way, when discussing how far along a pregnancy is, doctors usually use gestational age, which is the length of time since the beginning of the woman's last menstrual period. Since ovulation usually takes place about 2 weeks since the last period, and then it's another 2 weeks until implantation, if a woman happened to find out that she is pregnant the instant the blastocyst implants in the uterus, she would already be considered 4 weeks along gestationally. I just wanted to let you guys know the difference between weeks of gestation versus weeks since conception. The next period of development is the embryonic period, which occurs from 2 to 8 weeks after conception. This is when the cells begin to differentiate. The inner layer of cells develop into the digestive and respiratory organs. The outermost layer will become the nervous center, eyes, ears, nose, skin, and hair. The middle layer will become the circulatory system, bones, excretory system, and reproductive system. The germinal period is 2 weeks long. The embryonic period lasts about 6 weeks. The remaining 7 months is the fetal period. About 3 months after conception, the facial features are distinguishable and the fetus starts moving, although the mother can't feel it yet. By the end of the 4th month, they experience a growth spurt in their lower limbs, and now the mother can feel them moving. By the end of the 5th month, their fingernails and toenails have formed and they are more active. At 6 months, or about 24 weeks after conception, the fetus is viable, meaning it is possible for them to survive outside the womb, although their lungs are not fully mature and they would have extreme difficulty breathing. By the end of the 7th month, the fetus weighs about 3 pounds. During the last 2 months, fatty tissues develop and the functioning of various organs such as heart, kidneys, and lungs steps up. At birth, the average American baby weighs 8 pounds and is about 20 inches long. At birth, babies have approximately 100 billion neurons. During prenatal development, neurons move to specific locations and start to become connected. Basic architecture is assembled during the first 2 trimesters. The 3rd trimester and first 2 years of life are typically characterized by increased brain connectivity and functioning. 4 phases of development involve the neural tube, when the nervous system begins forming as a long, hollow tube located on the embryo's back. Neurogenesis, when the neural tube has closed and just goes wild with making a whole bunch of new neurons, as many as 200,000 neurons per minute. Neural migration, when the nerve cells start moving outward from their point of origin to their appropriate locations and creating different levels, structures, and regions of the brain. And finally, neural connectivity, where connections between neurons begin to form. This is a process that continues after birth, and we'll talk about it more in the next chapter. It's very important in pregnancy for the mother to get adequate prenatal care. Part of this is taking the B vitamin folic acid, which helps prevent neural tube defects such as failure of the neural tube to close all the way. In anencephaly, the head end of the neural tube fails to close, and the highest regions of the brain fail to develop, and death either occurs in the womb, during childbirth, or shortly after birth. In spina bifida, incomplete development of the spinal cord results in incomplete development of the spinal cord. This results in various degrees of paralysis in the lower limbs. There are a number of diagnostic tests that can be done to determine whether a fetus is developing normally. The most common is ultrasound sonography, a procedure in which high-frequency sound waves are directed into the pregnant woman's abdomen. This lets you get a glimpse of the fetus and see whether there are any structural abnormalities, or, on a lighter note, whether it might be a boy, a girl, or multiples. Fetal magnetic resonance imaging, MRI, uses a powerful magnet and radio waves to generate a detailed image of the body's organs and structures. This provides a clearer, more detailed image than ultrasound. There is also chorionic villus sampling, where a tiny tissue sample is removed from the placenta and analyzed for genetic defects and chromosome abnormalities. There's amniocentesis, where a sample of amniotic fluid is withdrawn by syringe and tested for chromosome or metabolic disorders. And there is maternal blood screening, which is a triple screen blood test used to determine elevated risk factors for birth defects. There are many potential hazards to prenatal development. A teratogen is the term for any agent that can potentially cause a birth defect or negatively alter cognitive or behavioral outcomes. Damage and type of defect due to exposure of a particular teratogen is influenced by the dose, genetic susceptibility, and time of exposure. Dose refers to how much of it. For example, exposure to alcohol during pregnancy is a teratogen. However, the severity of the damage is going to be greater for someone who drank heavily throughout their pregnancy versus someone who had a single glass of wine during the entire 9 months. Some embryos or fetuses may be especially vulnerable to certain teratogens based on their genotype or based on how the mother's body metabolizes a particular drug. And there is type of exposure. Some teratogens do more damage at some points of development than others. The danger of structural defects caused by teratogens is greatest in the embryonic period. The period of organogenesis, in red, lasts for about 6 weeks. Exposure to teratogens during this period may result in certain bodily structures not forming correctly or not forming at all. Later assault by teratogens, in blue, mainly occur in the fetal period, and instead of causing structural damage, they're more likely to stunt growth or cause problems with organ function. Many things act as teratogens on a developing fetus. Many prescription and non-prescription drugs can be harmful, as can any psychoactive substances such as caffeine, alcohol, smoking or exposure to smoke, illegal drugs, and painkillers. For example, smoking has been implicated in as many as 1 in 4 infants with low birth weight, and also contributes to preterm births, sudden infant death syndrome, and cardiovascular problems. And it doesn't stop there. Other hazards include diseases and infections during pregnancy, poor maternal nutrition, high maternal stress, high maternal age, and environmental hazards such as radiation or pollution. Because of all this, it is extremely important that pregnant individuals receive adequate prenatal care. This includes screening for conditions and diseases, nutrition services, exercise, and social support. This care is especially valuable for first-time mothers and women in poverty.